Okay, so we're looking at the hips, improving range of motion at the hips. These can be restricted, tight, painful for a multitude of reasons. The main one I see as a therapist is from sedentary lifestyle, so from sitting a lot. Whether you sit a lot, whether you run a lot, whether you squat a lot, it's an area you really, really need to and want to focus on. Improving range at the hips and making sure that the muscles are supple through the hips can offset things like low back pain, knee pain, ankle and foot pain, even shoulder pain. So it's a huge, huge area, and it would be my go-to to improve range of motion in other areas such as overhead or even just sitting and working at a desk. Okay, so the first area, the biggest muscle around the hip are the glutes. So we're going to go straight in, we're going to use a mobility ball. We're going to work into the one side first of all. So you're just going to pop the ball under your right bum cheek, and you're going to just slowly move around, pretty much searching for areas which feel tight. Once you find an area which is uncomfortable or feels tight, you can extend the leg out and very, very slowly pull the knee into the chest. So we're putting the glute through a slight stretch as we press into the muscle. So you want to spend at least a minute searching around the glute in the first place for a tightness. Then where we want to go is towards the coccyx, that bony bit at the base of your spine. You're going to press onto that bone, extend the leg out, and very slowly pull the knee into the chest. You may get some referred pain down the back of the leg. Just move nice and slowly through. Some neural tension there through the glute. And what we then do is we move up towards the top of our pelvis, where you're going to need to drop to the elbow. You're going to then pull the ball around in line with the top of the pelvis onto the side of your hip. Once you get into this position, you extend the leg, and then you just work through a rotation at the hip. So we're actively releasing the smaller glute muscles around the back side of the hip. A couple of minutes spent here, moving further around onto the very side, onto the very small glute min and glute med, pressing onto the side of that hip, and again, you can work into a little bit of rotation to actively release through there. Then you're going to rotate around into your pocket. So you're bringing the ball into your pocket of your trousers, resting on the elbows, supporting your weight with the other leg, bend the knee, and then just drop the knee out to the side. So just a couple of pulses, moving the ball deeper into the pocket as you go, and that's going to feel like a real nice release down through the front of the outside of the thigh, and maybe up into the hip there if you're tight through that muscle. So we work from the glute round into the TFL. We want to now do a little bit of movement work to go on top of that. So we've done some active release work with the ball, some trigger point work. Now we're going to work into the hip joint itself. So the same leg we just worked, we're going to bring into a lunge position. You want your knee over your ankle. You're going to support your weight on your opposite hand. And you're going to extend your rear leg away from you, relaxing that foot. So you want to push this knee slightly forwards and then away from your body and pulse for 10 to 12 pulses until you feel like you're getting a little bit more movement through this hip here and this hip here at the front. If you have the range to do so, you're going to drop onto your elbow and continue to push away through that hip. This exaggerates the stretch through the hip here. If you are quite stiff through your hips and maybe your back, you might feel a little bit more comfortable to stay on the hand, and that's absolutely fine. But we're working on getting that knee as far away from that midline as we can, keeping the foot grounded. So once we've spent maybe a minute or two in that position, you want to bring both hands to the floor and you want to bend this back leg. So from the side, we've got this extended hip here. We want to bend this back leg and you might feel a pull coming up through the thigh. Okay? If that's not enough of a stretch for you, so if this feels okay, this is tight, you're going to do 10 reps just bending to straightening. If that feels okay, you're going to bend this leg, and with the right hand, you're going to reach around and take hold of the foot, and then squeeze your bum for a count of 5 until you feel that stretch at the front of the thigh really light up. Once you've stopped squeezing for 5, relax but keep hold of the foot, and repeat twice more. So squeeze your bum for 5, push your hip to the floor, relax the squeeze, hold the foot, once more squeeze, and then relax. You should feel like you can have a lot more range coming through that hip now, okay? So you had the option of either pulsing through the knee, or if that felt fine, grabbing hold of the foot and squeezing the bum cheek to activate through the hip flexor here. You're going to repeat all of that stuff on the same in the same fashion on the other hips. You're going to work through the ball first, through the glute, all the way around through the back of your hip, around the pelvis, into the side, down into the pocket, and then into that lunge position. Then we're going to look at that rotation of the hips. So we're going to go into a pose called pigeon pose. And this is really important that this is done properly, because otherwise you're going to miss the whole impact of what this is meant to be stretching. So, push-up position, foot through to left hand, so right foot through to left hand, hold the foot in place. Drop the back knee to the floor. The front knee should naturally come into contact with the right arm, and you should have roughly 90 degrees behind this knee here. From there, as much as you have the range to do so, you're going to take the back leg away, which will lower this front outside shin to the floor. You might find that you don't get contact with the ground, and that's okay. But what you don't want to do is drop and collapse into the outside of the hip. So we're keeping the hip square, the knee angle as close to 90 as you can, blocked the foot in place, you've blocked the knee in place with the opposite arm, and we're pushing, actively pushing that leg into the floor. For a count of 5, you relax, you try and sit into the stretch a bit more, press again for a count of 5, do that 3 to 5 times. In total, you'll have been in this position potentially up to 2 or 3 minutes. The longer you can be here, the better. And eventually, you can release that leg out. You want to repeat the same thing on the other hip, and it will be completely normal if one hip feels more mobile than the other. Continue to work both sides, okay? So you don't get any discrepancy in the mobility and the range improvement if you only work on the one side. If you have an injury, always work bilaterally when you mobilise, especially when it comes to the hips, because it affects the spine so much. So you've had a huge amount of information there, a lot of stuff with the ball to start releasing first, and then that movement work comes in secondary. Have a little test, see what your movement feels like before and after, and see what you feel benefits it the most.